with justorthopedic.com, sitting across from Dr. Jeff Zhao with Dallas Orthopedic and Shoulder Institute. And he certainly knows a lot about shoulders, so I'd like for you to tell us a little bit about some examples of a complex shoulder surgery and possibly even a patient success story.
So I credit most of my shoulder experiences to my mentors in San Francisco. I had a tremendous experience with them. Now, once people has already underwent several surgeries or sometimes shoulder replacements that are not working well. Things such as infection, where all the hardware has to come out, or their fracture or broken bone occurred around the previous fixation sites, or simply shoulder to start dislocating. All those things makes everything very, very difficult, because the original anatomy has already been distorted, sometimes multiple times. So what you expected already there, they are not there anymore. There are certain things around the shoulder that provide certain function. Those function are gone. So you start making stuff. You started a reconstruction. Essentially, is what's available to me and how I'm gonna modify it so we can make up the things that are already missing. And so you got to start assessing what's left over, what's not working, and tell patient that the risks are number 1 this, number 2 this, number 3 this, number 4 this. Now the benefits are number 1, our number 1 goal will be this, number 2 goal will be that, number 3. So everyone has an expectation of what is going to happen. Now I remember distinctively maybe a patient of mine 3 years ago, 75-year-old gentleman, fairly an active gentleman. If you look at him, he'll probably look like a late 50s. He had a reverse shoulder replacement. It's a specialized shoulder replacement for someone's rotator cuff are just gone and unable to repair. He kept on dislocating, and fairly early on, he had another surgery, try to fix that, and again, within a short period of time, he started dislocating. So I spent tremendous amount of time to determine what are the factors that I can change so that he would not have a third failure. So when I met him, I went over all the little details of what to expect. So on a surgery day, taking all the previous hardware out was quite difficult. I mean, it took me a good couple of hours just to remove the previous hardware and re-implant everything else. I told him his expectations, and our number 1 goal is so your shoulder does not dislocate, because it's painful and he has no function. Number 1, no dislocation. Number 2, maybe give you some function. I gave him the expectation of just raising his arm right about his below his eye level. That's probably what you're gonna get. Anything outside of that is just gravy. It's from sheer luck. So he has done actually very well. Within the first 3 months, he surprised me a lot. He was able to regain his he was able to reach about between the second and third shelf, which is quite remarkable in terms of amount of surgery he already had somewhere else and the amount of revision I have done. All the nerves are functioning. I did not break any of his bones intraoperatively, which are all fairly high risk. So that part right there, I told him that I got you to here. The rest of it is your job. You got it yourself over there. That's all you. So we were both pretty happy with that.
That's amazing. So it sounds like you're his hero.
No, he's my hero.
And vice versa, I would imagine. So, and it sounds like he was very involved through his treatment process too, but yeah. What a wonderful story. So thank you for sharing it with us today.
Thank you.
Again, this is Dr. Jeff Zhao with Dallas Orthopedic and Shoulder Institute. I'm Elisa with justorthopedic.com. Please visit us on Facebook, LinkedIn, and Twitter.